Let's talk about those pesky vertical lines that some people get on their upper lip as they age. They're often called smoker's lines or lipstick lines. Is it actually possible to get rid of them? Before we answer that, let's break down the folds and lines around the mouth area. Some of these lines help define where the upper and lower lips start and end. The upper boundary of the top lip is the base of the nose. Moving out laterally, you'll find the nasolabial folds running along here, which separate the upper cutaneous lip from the cheek complex. As for the lower lip, the separation between the lower cutaneous lip and the cheek is the marionette line. Both the nasolabial folds and marionette lines become much more prominent as the cheek complex descends with the aging process. The bottom lip's boundary with the chin is marked by the mental crease, which is a more horizontal line. It's also possible to have a horizontal line form right along the upper cutaneous lip as well. Not everyone has this, but some people develop a static line that's present at rest, while others only see it dynamically when moving their lips. Remember, all wrinkles form perpendicularly to the underlying muscle fibers. In the mouth area, the orbicularis oris is a circumferential muscle. So when you look at those vertical lines on the upper lip, they run perpendicular to that muscle. Because the muscle fibers run horizontally, you end up seeing vertical lines forming on the surface of the skin. These lines are much more common in women than in men, which comes down to skin thickness and facial hair, as hair tends to be protective against these types of lines. They naturally develop as we age, sometimes appearing as early as our mid to late 30s. Several predisposing factors contribute to them, including genetics, sun damage, smoking, alcohol, and repetitive facial movements. Bone loss or tooth loss as we age is another major factor. As we lose that underlying structural support, the skin starts to feel the effects, leading to more wrinkles and a longer philtrum. Many people find these vertical lip lines extremely difficult to hide. Foundation or lipstick can easily bleed into them, making basic makeup application a real hassle. When thinking about treatment for these vertical upper lip lines, the first step is lifestyle modifications. That means avoiding smoking, as we know it accelerates these lines, and skipping the straws, since that repetitive pursing movement deepens them. It's just like our facial expressions. If we're constantly making certain movements, we end up with vertical 11 lines in our glabellar area. Retraining your face and your facial muscles to minimize those movements is really important, even if it's tricky. Now, let's dive into potential cosmetic treatments. First up is proper skincare, starting with daily sunscreen. Reducing sun damage leads to healthier-looking skin with fewer wrinkles. Hydrating the area is also crucial, which you can do with moisturizers and hyaluronic acid serums to boost hydration in that upper lip skin. Then there are retinoids, which increase cell turnover and promote healthier skin. For recommended AM and PM routines, make sure to check out our dedicated video on that topic. Another option is oral collagen. We have a dedicated video on this as well, but essentially, consuming hydrolyzed collagen can help improve skin hydration and reduce wrinkles. While the data on oral collagen is mixed, it appears to be a safe option to try, especially if your diet lacks sufficient collagen. Next, we have Botox treatments. When using Botox in the upper lip, the quantity must be very mild. Using too much of this neurotoxin can make it difficult to eat or speak, so you have to be careful not to overdo it. Even small amounts can cause functional deficits in certain people, lasting about 3 to 4 months or up to half a year if Daxxify is used. Be very careful about who you trust with this technical injection. Then there's filler, with hyaluronic acid filler being the most common choice to smooth out those vertical depressions. However, it isn't my favorite option for these lines. Placed too superficially, filler can cause the Tyndall effect, migrate out of place, and dull the sharpness of the vermilion border. Adding filler to the upper cutaneous lip can also elongate and stretch out the philtrum further, leaving people unhappy with the added length. For a slightly more permanent solution, you can consider a fat transfer from an area like the abdomen to the upper lip. Fat can be injected into the red lip itself or into the cutaneous lip. It contains stem cells that work to rejuvenate skin quality, which is a major positive. You can even use nanofat, a further reduced and purified version, which contains primarily stem cells rather than fat cells. This brings less volume to the area while delivering more regenerative benefits. Microneedling is another tool to stimulate the regrowth of healthier skin. Some people attempt this at home with dermal rollers or stamps, but I always recommend getting it done professionally to safely boost circulation and resurface the area. We also have a full video on red light therapy, which has been shown to help reduce wrinkles. Applying a targeted device or a larger panel over the area can yield real benefits for upper lip lines. Right now, choosing the right device can feel like the Wild West, so make sure to stick with reputable companies. But the data does support red light for reducing wrinkles, including on the upper cutaneous lip. A few other devices used for this purpose include radiofrequency, microcoring, and the plasma pen. We have a dedicated video on microcoring or EllaCore technology, explaining how it works and what it can do. The plasma pen creates tiny controlled injuries to the skin surface that can lead to healthier looking skin over time. For a more definitive treatment, I suggest laser resurfacing with an ablative laser like a CO2 or erbium YAG. These reach the proper depth to produce real results. If you treat the area too lightly, you won't see much change. You need to go deep enough to ignite cellular change so the skin heals in a more youthful way. However, the deeper you go, the greater the potential side effects, including pigmentation changes and bacterial, viral, or fungal infections. As the risks rise, so does the potential for improvement. So make sure you see an expert who understands laser technology and knows which laser is safe for your specific skin type. Chemical peels are another route, and we have a dedicated video covering them in detail. They range from superficial peels that target the outer layer to deep options like a phenol peel. Just like lasers, deeper peels carry higher risks. One thing to keep in mind, if you resurface only the perioral area, that skin might end up looking noticeably different from the rest of your face. It's often advisable to treat other areas of the face as well, rather than focusing solely on the upper lip lines. Ultimately, it comes down to what bothers you most and making an informed decision once you understand the risks and benefits. As a practitioner, patients frequently ask me if a lip lift can help with upper lip lines. I find that while the lines may look less obvious for the first few weeks due to surgical swelling, they do return over time. A lip lift does not resolve these lines and rarely improves them long term. However, by shortening the philtrum, it takes attention away from the area so the eye naturally focuses elsewhere instead of fixating on a long philtrum with vertical lines. That is a potential benefit, but it is not a curative treatment for the lines. What I tell patients interested in a lip lift who also have vertical upper lip lines is to perform the lip lift first, then wait at least 3 months. At that point, you can pursue laser resurfacing for both the surgical scar and the vertical lines. To me, that is the ideal treatment sequence. Ultimately, the best strategy for vertical upper lip lines is prevention, never getting them in the first place. But if you do have them, there are a variety of non-invasive and slightly more invasive options available to achieve noticeable improvement. While they may never disappear completely, you can get significant results when placed in the right hands. I'm Dr. Berg, and thanks for watching. Make sure to subscribe to the channel for more tips.